Medical school or PA school? Should you become a doctor or a physician assistant? This is a choice that a lot of us have struggled with before finally making our commitment and just choosing the path and going in that direction, and then choosing to become either a PA or a doctor. Now, a lot of people have made the choice after they become a PA to go to medical school, but that's rare, few and far between. But that's actually what this comment is about. So this is on my video, PA to MD. Have I thought about going back to school to become an MD or a DO, even though I'm already a PA practicing for almost 3 years? And my answer was yes, I've thought about it, but I usually just kind of decided not to for a bunch of different reasons. But there's also this kind of trope where, oh, PA is a backup option. If you're a PA, it's because you couldn't get into med school. Nah, BS. Absolute BS. Med school is harder to get into, but people who are competitive enough and smart enough to get into PA school, if they put their minds to it, I bet most of them would be able to get into med school. It's just a harder process. It's a longer process. You do need better grades. You do need to take the MCAT. It's a harder process overall, but I do have full faith in almost anybody who's made it into PA school to make it into med school. That aside, that video was all about choosing to be a PA instead of a medical doctor, an MD. And what this person said is, I actually printed it out so I don't have to read off the screen, but what this person said is, I'm finishing up PA school and have been having these thoughts of going back to med school as well. I guess I never thought I could become a doctor. This was the confidence issue that I mentioned in that video, that some people go to PA because they don't really have the confidence that they could make it through med school and could become an MD, not even just to get in, but could even finish it. But this person is saying that being in PA school made her realize that she probably could, and gave her tremendous confidence. So now it's an even harder choice. Like, shoot, I could have possibly become a doctor, but now I'm here. So she said, I guess I never even thought of becoming a doctor until my clinical year, where I got to rotate with medical students and residents who would tell me all the time that they were impressed with the stuff that I knew. But I've made peace by reminding myself that just because I could does not mean I should. I'm going to repeat that. I could does not mean I should. Just because you are smart enough, your grades are good enough, you are capable enough to become an MD does not mean that PA is the wrong choice for you. I could does not mean I should. So she said, I could does not mean I should. I hope to be a mom one day and haven't even dated in PA school, so Lord knows that probably won't happen in medical school. I don't know about that. I mean, people have families in med school. People meet each other in med school. They date, they get married, they have kids while still in med school and residency. Is it optimal? No. Is it good for you or for your spouse or for the kids? Probably not, because you're tremendously stressed the whole time financially and just physically stressed. You're not sleeping. Like, it's probably not a good situation for anyone. But that situation gets turned around pretty quick with that massive income that you get after med school. So I don't know. I mean, life's not perfect. So I don't know if I would agree with that, that just because this person is so busy in PA school that she's not dating, that the same thing would happen in med school. I don't know necessarily. But anyway, so Lord knows that probably wouldn't happen in med school either. Plus, the lateral mobility is fantastic as a PA, and I'm sure I will appreciate when I'm older and needing a change. The grass is always greener on the other side. So that all I completely agree with. The lateral mobility, if you're someone who can't really imagine being stuck in one specialty and wanting to like experience a lot of medicine, a lot of different things, a lot of different jobs, not just doing kind of the same thing over and over again, which not to put down doctors, I'm very glad that they're like that, but I personally also agree that lateral mobility is a huge thing. I'd love to be able to just like switch if I want to and do something totally different, whether that's a totally different kind of job or a totally different specialty and field altogether. So that's kind of good for those of us that have a little bit of career ADHD and want to switch around a lot. But so what I said to this person is, that's such a good attitude. Just because you could does not mean you should. And then I brought up Kevin Jubal, if you guys have heard of him. So Dr. Kevin Jubal, he started Med School Insiders. He graduated medical school, got into a plastic surgery residency, which is the one, maybe the second most competitive specialty. It's extremely competitive. And then he quit after 1 year to pursue entrepreneurial ventures, to work on Med School Insiders, the company that he founded, as well as another company. And he has a video about how he made that choice, realizing that his time is finite. He cannot do everything in this one lifetime, and he has to commit himself to where he thinks he'll be most effective and most satisfied. And then also, I just said about the thing with the family. The same can be said for a family. Just because you're not trying to become an entrepreneur or whatever, wanting to do other things with your time aside from just medicine, is a good choice to become a PA. So the same thing goes with building a business, with having a family, with straight up just knowing that you don't want to work 60 hours a week, that you just want to enjoy your life, but still practice medicine. PA is definitely more conducive to having a life outside of medicine, which is why I personally chose it. And it sounds like this person agrees. So just because you're smart enough to become a doctor, just because you love medicine and you want to practice medicine, does not mean that you have to go all the way to the tippity top and be an MD or a DO. PA is a great career choice for those of us that do love medicine, do want to do it as a career and can't imagine doing anything else, but also have other things that we want to do in life. So, for instance, if you've ever heard of the dream board, making a dream board either on Google Docs or actually like printing out pictures from magazines and stuff, and putting together a poster board with all the things in your life that you have a dream of accomplishing or having. So on my personal dream board, I have a house in the mountains, a house on the beach, lots of toys like four-wheelers and snowmobiles and pets and a family. And my dream board, my when I close my eyes at night and I think about being 60 years old, what I think about is sitting there at my mountain house or at my beach house somewhere with a bunch of grandkids running around, being happy, knowing their names, having them know me, having them having memories of me, not just always being gone at the hospital. That's what I want for my life. I want to experience life to the fullest. I want to have kids. I want to have grandkids. I want to like have a legacy here in the United States since my family moved here in the 90s when I was young. So I want to like I want to start this like big, beautiful, awesome family. And I just know that being a doctor is not as conducive to that. You can start one, but you'll never see them. They won't know your name. They won't know anything about you because you're always at the hospital. You're always on call. You're always gone. Maybe not most doctors, but a lot. And then if I were to choose, medical school, I probably would want to do something surgical because it just sounds like fun. So, and then like surgeons are just always on call, always gone. So for me personally, I made that choice where, yes, I still love medicine. I want to practice it. I want to do as much as I can as far as taking care of my patients. But do I want it to be my entire life? No, I don't. And I made that choice, and it sounds like this person did too. And yeah, I hope this video helps you make your choice, which path to pursue, and then just which direction you want to go. Also, I really want to again emphasize I'm not putting down doctors. I'm so glad that they want to commit that much of their life to medicine. I just personally know that I can't make that commitment. And I'm very glad that you guys out there that are choosing medical school are able to make that commitment. So, anyway, guys, hopefully this video was helpful. I know it's a very tough choice. And just remember again, just because you can does not mean you should. But if you do have a burning desire to be that top dog in medicine, to really know medicine all the way from the ground up, as well as an MD does and a PA never will, then maybe medical school is for you. All right. Hope that helps.